Listen in.
Press star 0. Thank you. I would now like to hand the conference over to your speaker today, Mr. Michael Schomer. Please go ahead.
Thank you for joining us for the COVID-19 media call for June 26th. We'll start today with a situation report from Health Commissioner Jan Malcolm. Following Commissioner Malcolm, we'll hear from Infectious Disease Director Chris Erzman. After those updates, we'll open up for questions from reporters on the line. With that, we'll now turn it over to Commissioner Malcolm.
Thank you, Mike. Good afternoon, everyone. I'll be brief today. At the global level, as of early this morning, we were above 9.6 million cases and 489,000 deaths. So rapidly approaching the 500,000 mark in global deaths, very sadly. In the United States, as of this morning, we're at more than 2.4 million cases and over 124,000 deaths. And certainly the notable increase in case growth day over day in recent days has been the subject of much news and much focus, as it should be. Here in Minnesota, we are now at a total of 34,616 laboratory confirmed cases, which is up 498, so almost 500 from yesterday. That 498 new case total is now the third day of increasing case count and is the highest number of new cases we've reported since June 5th. This case growth for today is on a high testing volume of over 14,500 tests processed yesterday. So in that sense, the higher number of cases might well be expected. But we're certainly going to be watching this trend closely, especially in light of what we're seeing in many other states in recent days. The median age of cases is now 39.6 years old. 6 years old, continuing to trend down. So that obviously means that more of the recent cases have been in younger people than we had been previously seeing. I think Chris may comment further about that. Sadly, we had an additional 5 deaths in Minnesota yesterday, so we are now at 1,411. 4 of these individuals were in Hennepin County, 1 in Dakota. 1 person in their 90s, 3 in their 80s, and 1 person in their 60s. There are 335 patients currently hospitalized, 157 of these in intensive care as of today. Notably, this is more than 40% below the high point for the numbers hospitalized on any given day, which occurred in late May. With that, I'll turn it over to Chris Erzman.
Thank you, Commissioner. On our last call, I talked about some concerns that we had in Blue Earth County and a cluster of cases that we were seeing linked to younger adults getting together in bars and restaurants. I wanted to let you know that we have had over 100 cases associated with bar activity. The particular dates or focus of dates, June 12th and 13th, and in particular at 2 establishments, Rounders and the 507 in Mankato. And so if individuals had frequented those establishments and are experiencing symptoms, please do consider being evaluated. We continue to follow up on those situations, and as we've continued our investigation, we've learned that a number of those younger adults work at child care facilities. And these contacts now mean that these facilities have to take precautionary measures that will mean hassles for the children and the parents of those children. It's a sad example of how COVID works. Just because you feel you're not at risk, that doesn't mean that you can't get COVID and spread it. Young adults associated with 2 bars in the Dinkytown area of Minneapolis. The bars are College Club and Cowboy Jack's. The recent onsets for these cases are between June 14th and 21st. So again, please be aware if you frequented these establishments, if you are symptomatic, please get tested. We are hearing similar stories around the country of how the average age of COVID cases is dropping lower and lower all the time, and spread among younger adults is picking up and becoming a primary route of transmission. Our median cases our median age of cases, as the commissioner said, continues to decline daily. It was 39.6 yesterday. It was 40.3 a week ago. And a month ago, it was 42. We are very concerned about the implications for our state, and particularly for more vulnerable Minnesotans who come in contact with those younger adults who may not be taking precautions. Our healthcare workers and public health workers continue to work extremely hard to slow the spread of this pandemic and to care for those who become sick. But we need Minnesotans to understand that those efforts will be undermined if we don't get cooperation from all Minnesotans, especially the younger adults who are most active and social. If we're to keep moving in the right direction on opening up our businesses, community, and economy, we desperately need younger Minnesotans to take COVID and COVID precautions seriously. We know wearing masks and keeping socially distant isn't fun, especially during nice summer weekends, but those are our best tools for slowing the spread and maintaining some level of openness. So with that, I'll turn it over to Mike Schomer.
Thanks, Chris. As we open it up for questions, we'll ask that reporters limit themselves to one primary and one follow-up so we can get to as many as possible. With that, operator, we're ready to take questions.
Okay, so as a reminder, to ask a question, you will need to press star 1 on your telephone. To withdraw your question, press the pound key. Please stand by while we compile the Q&A roster. We do have a question from Jeremy Paulson from Star Tribune. You are now live.
Thank you. With yesterday's disclosure or estimate by Dr. Redfield that every one confirmed case could mean 10 unknown cases, I'm just wondering how sure we are that this spread among young people was already out there. It's just now that we're testing and finding them versus an actual new source of transmission and outbreak.
This is Commissioner Malcolm. I'll start, and please, Chris, chime in. I just wanted to make the point that what Dr. Redfield said yesterday is really very much the same thing that Chris has been saying, and I've been saying for quite some time here in Minnesota as well, that we always have known that the number of laboratory confirmed cases was just a fraction of the true cases. And I think I mentioned quite early on that the range of estimates that folks had about how many additional cases might be represented by one laboratory confirmed case. It was quite a wide range of estimates early on. But I think that there is now some convergence around the 10% figure, which I believe is what we've been saying in Minnesota for some time as well. So that multiplier of the actual number of Minnesotans having been infected by COVID sounds in line with our estimates as well. Still a very small percentage of the overall state's population, which again, we need to keep just reinforcing that a small percentage of our population has been exposed so far. So that means that the great majority of Minnesotans remain vulnerable to infection. And with that, Chris, would you like to comment on Jeremy's question about whether this is a new route of transmission?
Well, yeah, certainly. I realized I use that phrase too, and I just want to clarify. Transmission is still via the respiratory route, so we don't. The means of transmission hasn't changed, but young adults are becoming increasingly part of that process. And when you asked about whether or not this was happening in this population, and we just started detecting it, I think that there is some truth. There's likely cases that were happening that did not come to detection until we've had greater capacity to do testing. I think in the case with young adults, I think that what we're seeing is that, yes, there may have been some cases in that population, but that has been amplified by the new opportunity for interactions in the social setting that the opening up of bars and restaurants has afforded. So yes, I think that there probably were a few cases in that age group that may have been missed, but in general, I think that what we're seeing now is an amplification of transmission because of all the opportunities to socialize and because of the concern that we've expressed that the socialization, it's not just socializing, but it's socializing with without masks and without social distancing. And so that's the concern.
And my follow-up question to that is, it's kind of a contrarian question in a way, but I mean, the whole reason we did the shutdown order, the stay-at-home order, was to buy time for hospitals to staff up and to add capacity, which they've done. And now we're seeing cases without those restrictions in place. But wasn't that the plan? I mean, we're not going to stop this spread until we have a vaccine or reach herd immunity. So isn't this just what's going to organically happen? And should we be concerned about what essentially is the natural course of this?
Well, I think Commissioner Malcolm again. I think Chris made the point in her comments that yes, it was to buy time to build up healthcare capacity, but also to buy time to learn more about how this virus manifests and how it spreads and how to protect as much harm to the health of Minnesotans as we can. So yes, it's continued progression through the population and continued growth is to be expected, but our whole goal has been to keep that rate of growth manageable and moderate, certainly for the healthcare system, but also, we've seen other examples where outbreaks can cause great disruptions to businesses and can cause us to have to go backwards on some of the desirable openings and lessening of restrictions on interactions. So I think the goal of managing the rate of growth continues to be an important one.
And I'll just add to that. I think that we absolutely know that we will continue to see cases, and that is just how things will be. But as the commissioner said, it's managing the rate of growth. And when you have 56 cases associated with one location from one weekend, that is not managing the rate of growth. And so that's what we're commenting on. Not that we expect to not see cases, but just that we want to make sure that we're behaving in such a manner that we're taking advantage of all the tools we have, so that even as we open up, we are not putting ourselves in a position to overwhelm the systems that we work so hard to strengthen.
Thank you.
Next question comes from the line of Greta Ko from Main Post. You are now live.
Yeah, I'm wondering, it looks like the Minnesota Medical Association today put out a statement calling for public and private leaders to urge people to wear masks indoors. I'm wondering if you have a comment on that and if there's any thought of requiring that more so than making it a guideline.
I think the evidence on the beneficial impact of masks has just continued to grow, and it's been one of the things that has frankly changed over the course of the pandemic in terms of what we knew about that and how valuable a tool we thought that was. So as the evidence has continued to get stronger about the benefits of mask wearing, we certainly have always urged that and strongly recommended it. As we look to further reopenings, I know that it is a logical question about whether strengthening that and actually making that a requirement for certain settings might make a kind of a logical companion, if you will, to the reopenings. And I'll just note that a number of localities, cities, and counties have taken that initiative on their own, and that certainly is something that we've been supportive of as well.
And then just as a follow-up, I think the last time we got an update on the Minnesota model was mid-May, and I'm just wondering if there's a scheduled update on that.
Yes, thanks. Yes, that's correct. The last run of the model, of the university model, was May 13th, I believe. The model, the principal investigator actually has gone out on maternity leave, and we congratulate her for that. So the model has not been rerun since May 13th. They are just now in the process of doing some updates to the input factors, and as we've said since the beginning, additional Minnesota data will be helpful in making the model more precise in the sense of having better real-time, real-life data to input. My understanding, I don't have a precise time frame, but they're hoping to have the model refinements completed sometime by the middle of July, and we'll be looking to do a run after that time. So it'll be, I would have to think several weeks yet before there's a new run of the model.
And sort of in that vein, I know for the last couple of weeks, we've sort of been in this holding pattern of cases being down with kind of waves of increases. Would you say that we're still there? And do you have any ideas about where we are going from here?
The kind of that general pattern of several days of decline followed by a couple of days of increase, that we've seen that repeated now pretty much weekly for the last probably 5 to 6 weeks, I think you'd say, Chris, with the general trend still being on the downward slope. So that's been really good news. I think as I mentioned, we're going to watch the trends really closely, and we always do, but over these next days and the next week or two, as has been commented on, I think by Dr. Fauci at the national level, the next couple weeks could be pretty telling nationwide in terms of what we're seeing with some of the states whose growth rates have come as a very unwelcome surprise. So we're going to be looking to see, as I mentioned, today's rate of increase or number of new cases, I should say more precisely, is the highest that we've seen since earlier this month. So we're just going to be interested to see what happens. But again, as I also mentioned, the volume of testing matters. So we're keeping a close eye on the test positivity rate. That indicator has crept up a little bit as well in the last week, but we'll keep a close eye on both of those metrics.
Thank you.
Next one on the line is Catherine Richard from Minnesota Public Radio. You are now live.
Hi, I wanted to go back to the Minnesota Medical Association's request for mandatory masking. I mean, just by way of background, here in Rochester, we are a medical community, and yet there's a fair amount of debate over whether these should be mandatory. How would you get people to do it if you went that route? How would you enforce something like that?
Well, I think the governor's been really clear in his comments throughout that we know that for this to work, Minnesotans have to really buy in and adopt these behaviors because they understand the importance of it. It's not just that it's a mandate. However, I think the strength of saying something is required as opposed to just recommended does matter. It certainly doesn't change everyone's behavior, but it's a stronger signal. So we're talking about that and looking at that quite closely, and also noticing with interest that more and more states and cities around the country are going to a requirement as the data becomes more clear and as the opening of commerce and social interactions becomes more desirable and more urgent from many perspectives. That anything we can do to mitigate the added risk of those increasing interactions is something we have to look at very seriously.
And just to follow up, do you have a sense of what the tipping point would be for the state to potentially require them? What would you be looking for? And would it be too late at that point? Would the horse be out of the gate if you get to that point?
Well, certainly, I think that we're hoping to just be better and better at getting the messages out to folks to understand why this is important. As Chris said in her comments, I think there's still a misunderstanding that the mask is about protecting yourself, and if you're not sick, there's no need for a mask. And even though we now do have some data that mask wearing is actually beneficial to the wearer, its importance for protecting other people from asymptomatic transmission is where the data has really become quite compelling. So I think, as we continue to evaluate and think about further, kind of every turn of the dial, to use the governor's dial analogy, every turn of the dial that opens things up increases social interaction. That's just a fact. And so the more interaction we have, the more the value of any protective measures that we can take, we believe, needs to be considered.
Really quickly, would you expect to deploy kind of one of those testing units that you've done in Malheur County, for instance, to Mankato anytime soon to do additional testing?
It's a great question, and one of the things that I think we're developing just more kind of routine procedures around is how to respond when there are hotspots. So there is a whole team that looks at precisely that, and I'm sure that team will be in close consultation with Chris and the EPIs to evaluate whether that would make sense. Chris, you may want to comment.
No, that's correct. We're in conversation with them.
Okay, thank you.
Next one on the line is Joe Cox from Minnesota News Network. You are now live. Joe Cox, you are now live.
Apologies, my question was asked and answered. Thank you.
Okay, so next one is Darren Benson. You are now live.
Thank you. You mentioned here in Mankato, a lot of the outbreaks are related to two specific locations. Is that the only place you're seeing the outbreaks in Blue Earth County, or are there other hot spots within this area, or is it all connected to the two that you mentioned earlier?
Yep. Yeah, those locations that I mentioned are the two locations that really were identified as kind of focal points. Definitely, people have identified or mentioned being other places, but those really were the focal points where we saw a lot of disease activity associated with people who had been to those locations. And that's not to say that there is not disease activity that is happening in Blue Earth County, just as part of the activity that we're seeing across the state. But as we're talking specifically about clusters in 20-somethings, more recently, those are the locations that we identified in that locale.
And to follow up on that, you said a lot of this activity was related to the weekend of June 12th and 13th. Do we maybe wait until the middle of next week to see if some of these cases turn into hospitalizations or ICU visits before we judge on that end of things? How much of a lay time do we need to see if the high increase in cases here in Blue Earth County becomes a high increase that potentially puts strain on the medical system?
Well, certainly, yes. We need so you need to have the exposure, then you need to have the incubation period, then you need to develop symptoms and get tested, and all of that adds days to the process. And then once someone's been identified as a case, yes, then we will look to follow up to see if there are hospitalizations or intensive care use. But I do want to also caution to say that it's not necessarily these individuals right now at this time that we're worried about, because thankfully we know that in our younger populations, they tend to have much better outcomes from COVID. But what we're concerned about is the subsequent spread from these individuals in other settings where they may be interacting, and then spread to people who do have underlying health conditions or who are at greater risk, and then have an impact on our system. So that will likely take a bit longer. But once we notice that we're seeing the cases in this population, we want to get the word out so that they're aware of the upstream impact their actions can have, so that we can stop that. Because yes, it takes a little while for all that to play out, but if we intervene now, the hope is that we will not continue to see this level of transmission. And again, it's not that you can't socialize, it's not that you can't have fun, but you need to do it in a manner that's safe for you and the people around you.
Thank you.
For the next question, we do have Todd McDonald. You are now live.
Thank you, and good afternoon, all. I was wondering, what is the latest word we've been hearing from our tribal nations? We heard a lot of talk about the vulnerability at the onset of this back in a long time ago, April. But have we heard any updates from the tribes? Is it under control on tribal lands?
Commissioner Malcolm, it's a great question, and certainly there's been a lot of rightly a lot of focus on protecting elders in the Native communities, both on the reservations and in the urban community. I would just turn to Chris for any specific data that she has about. We do provide reports and information to each of the tribes, of course, as we get it. But Chris, do you have access to any summary data?
Well, I can tell you that I can give you kind of some of the overall data by race and ethnicity, and this is also on our website. But if we look at what individuals have told us about their race, we have 90 individuals who have identified as American Indian or Alaska Native. But then we need to keep in mind that we also have 71 who've said they're multiracial, and 284 who have chosen other. So we are aware, obviously, of cases occurring in our tribal nations. I was made aware that the lieutenant governor had indicated that there'll be some testing that will be done this weekend that will be focused on some of the, I think it's in the metro indigenous population. So we have focused on trying to make sure that all these individuals have access to testing. So that may be something that you want to check on as well.
Okay, thank you.
We do have a follow-up question from Jeremy Olson from Star Tribune. Your line is now open.
Well, this will be a little bit of a curveball compared to the theme of the questions, but looking at yesterday's weekly summary report, one of the weird stats that jumps out at me is in gender. Cases are fairly even between men and women. Deaths are fairly even. But the one place where it really breaks is about 60% of the ICU admissions are men. There's a disparity there. It doesn't even show up in deaths, just in ICU admissions. It makes me wonder what's going on there. Have you looked at that? Do you have any theories on why more men are requiring ICU admission for their cases?
Chris, any thoughts on your part? Otherwise, we had talked before about getting Dr. John Hick on the call with us at some point, maybe next week. It sounds like a good Dr. Hick question, unless, Chris, you have some thoughts.
Yeah, I mean, we know that there are certain underlying health conditions that put individuals at greater risk for complications. And so that may be, those underlying health conditions may be more prevalent in males. But as you said, the fact that the deaths are not trending in the same manner is a little bit confusing. So yeah, we can certainly look at that. The other thing, though, is a single data point, a point in time. I think we want to also be careful. It may be that over time that changes again. So, but I do think that Dr. Hick or Dr. Linfield might have insights as well.
Thanks.
For the next question, we do have Eric Escola from Twin Cities Public. You are now live.
Hey, Commissioner, Director, did either of you watch any part of the White House task force briefing during the noon hour?
Hi, Eric. This is Commissioner Malcolm. I was unable to. I heard a little bit about it, but I was unable to see it. And Chris, I don't know if you did.
No, unfortunately, seems like there's not a lot of free time. But
well, let me ask my question.
Sure.
Then. The impact of the administration's messaging on mitigation measures, the rallies that the president's held in the Southwest, are those helpful? Is that a positive strategy? And how do you grade the effectiveness of whatever the federal plan is going forward?
Well, I think that the Governor Walz has made the point often and recently that really the lack of a cohesive federal strategy has complicated matters, and as you see now with such rapid growth rates in some states, that likely will impact us as well because people move around the country, as we know. So, in terms of a federal strategy, it's been a bit of a moving target. The degree to which specific criteria for opening should be followed or not, and the degree to which some of the messaging about the value of social distancing and masking and how that does or doesn't kind of get followed by example has not been helpful, if that was your question. But there may be something more specific you're asking that I'm not picking up on.
Well, I was wondering if you say there's not a coherent or not an organized federal strategy, where does that leave states like Minnesota, where so far it seems to be going at least fairly well? Do you need the federal help or a federal plan?
Well, I think my point was that would have been helpful certainly earlier on, and I think it would always be helpful. But the point I was trying to make was just that as we see the experience continue to unfold in individual states, I think we have to be mindful of the fact that certainly we need to learn lessons from what can we learn from why some of those spikes seem to be happening in some of those states, but also just because people are moving around the country, and we need to be, and we are looking in our case investigations for travel-related exposures that may impact us here as well. Chris, would you have anything to add?
Well, yeah, I think that leadership sets the tone, and certainly that can help get messages across. And so that's always an important part of cohesive messaging, is that everyone is sending the same messages through their actions and everything. So that can add challenges if that isn't happening. And certainly, as the commissioner said, when we're seeing cases in other parts of the country, anytime you have cases, it puts everyone else at risk. So that's a concern. And then the other thing is, we're hoping that the cases that we're seeing in other parts of the country will serve as a warning here in Minnesota to say, hey, we want to make sure that we continue to do things collectively as a community to avoid this. But we also want to make sure that people aren't saying, hey, they're doing all kinds of stuff in these other states, we want to do it too. So we hope that it's a cautionary message for people, but it could also send the wrong message that more free activity without taking into account the necessary social distancing and mitigation efforts, that they aren't necessary. That would be problematic if that was a message that people took away.
Thanks. Operator, we have time. We have time for one more question.
Okay, so for the last question, we do have Paul Scott from Forum News Service. You are now live.
Hi, thanks so much. I'm wondering about these 4 establishments that you traced outbreaks to. If you could characterize what was going on there, whether or not they were shoulder to shoulder, is there anything about how crowded they were that would explain the outbreaks?
Yeah, I'll leave the details to Chris, but certainly there was a lot of social media about, and photos and so forth, just showing that, indeed they were pretty crowded environments. Chris?
Yeah, no, absolutely. And I think one of the things that's important is that the guidance that we've provided about for bars and restaurants is that, people need to be seated and they need to be able to socially distance. And so I think that's really important. I think in the case of these establishments, that guidance may not, or very likely was not being followed. And so it's that, again, very close together, absence of masks, and lots of people having the opportunity to be exposed.
So do you anticipate levying any penalties on bars and restaurants that pack people in right now?
We're working with the regulatory arm of the department, which includes our environmental health division, and so they are the division that inspects and regulates restaurants and bars, and so we're working with them on this issue and how we can promote the best practices within these facilities.
Yeah, that's right, Chris, and as well, when folks register concerns with the public safety duty officer, for example, those get referred to local law enforcement, and the goal really has been education first and foremost, just making sure that proprietors and patrons know what the rules are. But this is so important to get right, that we're talking about how we can strengthen that communication over the coming days and upcoming holiday week.
Thanks so much.
That is all the time we have for the call this afternoon. I want to thank speakers and the reporters on the call. If you had a question we were not able to address, please feel free to reach out to our office. Have a good day, and we will talk with you on Monday.
Ladies.
That was the daily briefing from state health officials.